Good afternoon, everyone. Welcome back to Module 2, Community Learning Call number 2, the Healthcare Workforce Learning and Relearning Curriculum. It's so nice to see so many participants on the phone, and again, I thank you for your patience as we got set up this morning. I just want to remind folks that the focus of Module 2, if you weren't able to attend the in-person session nor the first Community Learning Call, is population health management and really focusing on HIT or health IT enablement. So some of the resources we've been discussing thus far have been the Delaware HIE DIN services, and you can absolutely access that recording via the website if you have any additional questions or weren't able to attend that. And today we have the joy of having a follow-up with Doral Jacobson. So she had presented during the June 7th in-person session. And she's going to be helping us take a deeper dive and really taking our QRUR reports and our value proposition to the next level. So I would encourage you all, if you're in a space that is not too loud, to feel free to unmute yourself if you have questions throughout, or you can type them into the chat. And please select all participants to make sure that we receive your questions. If you're unsure how to unmute yourself, you'll see in the Participants tab, so at the upper right-hand corner, there's a little Participants section. And next to your name, if you have a little microphone with a red, and it's red with a slash through it, that means you're muted. So please feel free to unmute yourself. Again, if you have questions throughout, this is very discussion-based conversation. So again, if you need anything or are not able to figure out technology, feel free to type it into the chat as well. And again, to all panelists. So without further ado, I am going to pass the ball over to Doral, and she will kick us off. Thanks, Doral.
Thanks, Jacqueline. I'm excited to be here today to talk to you guys a little bit in follow-up to our discussion a few weeks back regarding our learning around value-based data. So let's go ahead and get started here. From an agenda perspective, I'd like to really talk about payment reform and address any follow-up questions. And also, let's talk about the quality and resource use reports. I know we had some folks that were able to obtain those and some folks that were going to go back and try to gather that information. And I'd love to hear some stories regarding success or challenges or answer any questions relative to quality and resource use reports. And then we're going to talk a little bit about the practice value proposition and have some discussions related to that. Again, great time to ask questions of me. We can certainly share amongst our group, and then we'll go ahead and move forward with closing. So that's how we're going to move through our time today. So from a payment reform perspective, from a follow-up questions, I've got a few that are listed on the slide here, and I know we have a lot going on in healthcare right now in terms of legislation, even particularly with MACRA. The proposed rule came out, and we have a little bit of a glimpse about what the next years will be in the 2018 performance period. I'm sure there must be some questions regarding that, so I'd love to find out what you guys are thinking and answer any questions and get some guidance relative to what we're seeing in the marketplace in terms of reaction there from a reform perspective. So from a reform perspective, does anybody have any questions that you'd like to hear some feedback on regarding anything that we discussed or some of the new things that have happened? I hear a question coming.
Yeah, it looks like there's a little bit of feedback, so unless you have a question, if you could mute your line, that'd be very helpful. You can always type it into the chat as well.
I don't see anything coming in via the chat, but I do hear a little bit of feedback. Okay. All right. Well, I'll just share some of the comments that I've heard as I've talked with clients and spoken at a few conferences over the last week in regards to payment reform, and then I'll address questions as I see them in the chat box. Or if you'd like to ask any, certainly just raise your hand or shoot the question, and I'll be happy to answer them. So some of the surprises on the payment reform front, or things that I've gotten some questions on, are relative to the cost component in MACRA. As you recall, when we talked about the quality and resource use reports, really that had a lot to do with cost per capita and Medicare spend per beneficiary. So one of the, now it's proposed potentially that cost will again have a zero weight in 2018. So that is one of the questions that we've been getting is, you know, what does this mean? Should we stop looking at this data? How is this going to impact what our score might be in the future? You know, what do we do with this information? So what we're sharing is that we still believe that it's very important to get our arms around this data. And again, just as we talked about in our in-person session, the folks that are successful at understanding their total cost of care and using their data are going to be better positioned to perform in, you know, not only MACRA, but in the many models that we reviewed during our in-person session, because that total cost of care comes up again and again. And again, a lot of the data that we talked about is still relevant, even though it's possible that we won't be measured in the cost category in the next performance period of the quality payment program. So that's one of the questions we've been getting. How about action steps? Has anybody initiated any action steps around payment reform that they'd like to share with the group? Don't be shy. Jacqueline, do you see anything coming across on the chat?
I don't at the moment, no. Feel free again to type it in the chat, or you can unmute yourself by just clicking the little microphone if it's red for you.
All right, so how about, was anybody successful at gaining some feedback relative to sharing some of the information that you received at the conference back at the practice? Anybody have any reactions that they'd like to share, or information relative to some of the discussions that we had around the different payment models? Okay. It looks like we don't have a lot of questions relative to payment reform, but I'll also share that if they should come up in the coming weeks, you know, feel free to reach out, let us know. We're happy to support you in being successful in payment reform, and certainly let us know. All right, so let's move to quality and resource use reports. I know that there were several practices that were talking about downloading those reports. Was anybody successful at downloading some of the quality and resource use reports? Okay, you guys are very quiet. I don't see any coming into the chat. Or from a follow-up question perspective, if anybody had taken a closer look at their reports, were there any follow-up questions? Absolutely happy to entertain some of those. And I'll tell you some, you know, while I'm waiting to see if there's any chat questions that come in, I'll give you some feedback. I was at a conference actually early last week where I did a talk on the quality and resource use report information at the HFMA's ANI conference, and there were a lot of folks that were very interested in where their dot was on those matrix that shows up on the first few pages of the QRUR report. And some of the questions that came up at that conference were, what happens if the data is incorrect? And from one of the most important things, if we just want to reflect quickly on some of the learning that we participated in, that PACOS file still remains very important for us to look at. If we do have providers that are still connected to our group in PACOS, they could be impacting your performance now and in future years. And that was one of the questions that came up more than once. So making sure that that's cleaned up and you're disconnecting providers as they exit your organization is going to continue to be a very important workflow to capture. Any questions, anybody? Now's the time.
Thanks for that tidbit, Doral. We do have a question via the chat from Barbara.
Okay.
So some of my practices have downloaded last year's reports. Are the QRUR reports available for this year, and can anyone download?
Yes, the QRUR reports will become available again in September. So the 2015 data is the last data that we have right now. Great question, thank you. Another question that came up at a recent conference was, is this going to be the same data moving forward in the MIPS program? And here's what we know, and this is based on what we've seen with CMS in the past. A lot of the data elements will probably continue to, in the next version of reports that CMS pours out, but they'll probably rename them. So, perhaps they'll be called just resource use reports. We don't know. But usually CMS will rebrand things, right? I mean, we've seen that with meaningful use is now advancing care information. However, a lot of the elements are similar program to program. We believe that most likely will continue with this cost data as well. So, but we've had that question a few times, so we'll have to see what they rename it and what those data elements are. But they're measuring everybody on per capita cost and Medicare spend per beneficiary. So we believe that those data elements will still live in something that is very similar to what we see now in the quality and resource use report. And I'm curious to see if anybody has moved forward with requesting any outcome data from any of their payers or their hospital partners. Has anybody done that, been successful, not successful, dabbled in the outcome area? Okay. I don't see any chats on that. I continue to, with helping providers and establishing value propositions and understanding their total cost of care. It still does vary widely in terms of if you ask for outcome data from partners, sometimes they'll provide that information, other times they won't. I've seen some reports, some new reports from some on the payer side, United Healthcare in particular, where they've given some of my practices some very good information regarding their total cost of care and how they're doing on the quality side. So absolutely ask the question. I think it varies based on region, but a lot of that data will be very helpful to you in addition to the quality and resource use report. Well, let's go ahead and talk a little bit about the value proposition. So one of our questions from a key takeaway perspective, are there any follow-up questions regarding any of the things that we talked about around the value proposition, or did you initiate any action steps around the value proposition. Would love to hear some feedback around that. Okay, I see another question here. Many practices having difficulty understanding. Will the QRUR report in September be easier to understand? Okay, I'm not 100% sure, but I believe it will probably be consistent with what we've seen in the past. However, after September, the next iterations will most likely be different. So I believe they'll probably be very similar to what we've seen. And I have another one. The reallocation formula for specialists changed. My specialists don't know how to get the detail. Oh, the costs are coming in for tests and ED visits that are not associated with them. Now, that's that's interesting. That's actually a question that we asked CMS directly, was for some more detail around, okay, you're telling us that we've got a higher expense in this ancillary category, but we really need information around what that facility is or what that lab is. And they were not able to provide any of that detailed information. But here is one of the things that we can do, and I think this is really important to mention on this call, and that is we are right now in a comment period with CMS. So things like it's difficult to understand the QRUR, we need more detail so that we can take action around cost, any challenges that we have downloading. We can now submit comments. I'm not sure when the comment period ends, but we probably have 60 days or so to submit comments. And that's the way to help communicate to CMS our challenges and actually what would be helpful to us as practices in digesting all of this cost information. So unfortunately, they have not been able to provide any of that detailed information, but I completely agree, it would certainly be very beneficial. Good suggestion.
Doral, this is Jacqueline. Do you have an idea of how practices can provide that feedback to CMS?
Yes, on the CMS website, Jacqueline, I can actually send you a link to how you can respond with comments. It's on the CMS website, but it would probably be a little tricky to get to. So why don't we send that out post-webinar?
Of course. Thank you for that resource.
Sure. All right. So we're at the close, but before we close out here, Jacqueline, were you able to send that health affairs report out,
yes,
that article?
Yes, I didn't send it out to folks directly, but it is at the top. So you'll see it says Module 2, there's a tab, and then there's macro as a tab. So you can actually, with your screen, pull it up for folks.
Okay.
Just to reference it. And I will absolutely send it out as a resource afterwards.
Right, so this is something that would be a great thing to take a look at. It's actually based on a RAND study, and it's the effects of MACRA on hospitals and physician groups, and I think this is a really great way for us to start to understand how all of these different pieces are connected and what we can do from a practice perspective to be very proactive with these new payment reform models. So it's, the RAND study is actually a lot to get through. This actually kind of consolidates it and summarizes it pretty nicely. So we wanted to share that with you. And I don't know if anyone's read this article or has any comments or questions or wanted to discuss any of the elements of it, or if you've heard about this study yet, but certainly please post in the chat or chime in, and maybe we can chat about that as well.
So I'm curious, Doral, we'll definitely send out this as a resource, so thank you for sharing it. Could you give us a high-level overview of what some of those, where, to your point, what practice should be doing for quality payment and reform and programs? What did you find that your practices would be helpful, or tidbits?
Yes. Well, some of the most critical pieces are really alignment internally at the practice, making sure that there is sufficient education and really on the provider side as well as the staff side. That's one of the things that we continue to see is practices that are positioning for bonus. Everybody in the practice is involved and at least at some level knowledgeable about the goals, quality metrics, for example. I mean, even starting with the intake process, identifying, if you're on the specialist side in particular, if there are any chronic conditions that you need to be mindful of, if patients have a primary care physician, if they visited that primary care physician, really thinking about the healthcare experience on a more holistic level and having everyone engaged from the front desk all the way through the physician is definitely a success factor that we see. The other piece is really vendor management. This is one of the really challenging parts, is that many of the vendors are not ready with providing reports and information back to the practices regarding where we're at in terms of our measures. And that's very, very challenging. But practices that we feel are going to do well are the ones that are able to constantly communicate with their vendors and pull down that data successfully. So even if you haven't been able to do that up to now, I mean, we still have some time. I have heard a number of folks that have not been successful at getting that data as routinely as they would like. So we need to keep working with our vendors to get that information. I had a story come up at the HFMA meeting last week where someone indicated that they got a 4% penalty, and they thought they had submitted everything successfully, and their data showed in the EMR that they had indeed, met this measure. However, it didn't translate in some of their coding to their registry, so they ended up being penalized. And I think it's really the devil is in the details, unfortunately, with some of these measures. So practices that are positioned to succeed are really monitoring those details pretty closely. And I think the third element that we see in practices that are positioning pretty strongly are the ones that are thinking about this in a very payer-agnostic way. So we're working towards being successful in this Medicare program, but really thinking about it in terms of we're going to treat everyone in our practice this way. So when we do an intake, we're not really focusing on if you're this payer, we do this, and if you're this payer, we do that. But this is what we're going to do for all of our patients. So more of a population health approach. And, I think that it's amazing the correlations we see. For example, avoidable ED admissions. That's something that we talked about during our session. That's definitely something that's going to be scored in the cost area for MACRA, the QPP, but it's also very common in the shared savings programs on the commercial side. So it's really thinking about things holistically that reduces the administrative burden and then also positions the practice for success in the commercial world and also with the government payers. So, that's another piece, really. Those are kind of three key things that we see folks doing. Anybody have anything to share around that?
Just a comment from Gail in the chat. Thank you, Gail. She mentioned the deadline for the comment period is August 21st, 2017. So thank you for that follow-up, Gail. I appreciate it.
Actually, so we have a little bit of time here. So I have while we're still waiting to see if any more questions come in, I have kind of two quick stories to tell about how practices have used their quality and resource use report data to position. And one of them is a story of a multi-specialty practice that actually got a revenue-neutral proposal from a commercial payer, which was a huge surprise, and they were not happy with that. So we started to dig into, okay, how do you look from the outside? And we actually, surveyed their payers, and we took a look at their quality and resource use report, and we determined that per capita, they were 39% less less costly than their peer group. So we actually graphed that and put it on a value proposition and went to the table with this major payer. And we don't know actually what the proposed increase will be, but it helped make a very powerful statement because, again, this group is really thinking about things very holistically. So they're treating United Healthcare the same way they treat Cigna, the same way they treat Anthem. And that data was very powerful, and the chart was super easy to create. I mean, literally it was per capita cost for the group, per capita cost for peers, and we simply drew a red line with the savings so you could see, wow, this is pretty impactful. So that's one quick story about quality and resource use report. Another is that I have a really large orthopedic practice that I'm working with, and it's actually a practice that's comprised of several groups that have recently come together. And one of the things that we're looking at is each group's unique quality and resource use report. So, it's interesting, the implications from a recruiting perspective. So they're looking at each other's data and identifying which group might need help in a different area. Some groups had very good scores on the quality side. Others needed a little more help. Some groups actually had they were very cost-effective compared to peers, and other groups were not. So it was a great way for that super group, if you will, to kind of identify, all right, we probably need to focus on making sure that we're pushing all the right buttons to get these measures right on for the group A. And in group B, we need to work on the post-acute spend because that came up kind of high for them. So, it's a great way to really get to know each other on a whole new level when you start to look at and share data internally at the group. So those are just two kind of quick stories regarding some of the takeaways and experiences that groups are having regarding using quality and resource use report in a couple of ways. So what other questions are you thinking about as we talk about next steps and follow-up for our session?
Yeah, great question, Doral. So I was just about to jump in. I really do encourage participants to also ask your questions because Doral's a great resource for this. What comes up for me, though, is I absolutely hear the benefit of, sitting down, developing that value proposition, really looking at the QRUR data. And yet what comes up for me is, of course, what are some of the barriers to doing so? And I'm sure, Doral, in your experience, you have, perspectives of what are the common challenges that practices may have and some tips on how to overcome it. So a great example that was previously discussed in the chat was just being able to understand and digest all of the information in the QRUR reports. And, this call and folks such as yourself, Doral, are great resources to be able to understand that and dig deeper. I'm curious what else has come up for you in your experience, if you wouldn't mind sharing that with folks.
Sure. I think one of the primary issues is just obtaining the data in and of itself. A lot of folks try to log in and they identify that they don't have a password, and it could be that someone's left the organization. So just getting the reports in and of itself is definitely a barrier. And during our session, we provided those resource guides so we can we can start to use those to pull down that information. The other barrier is even if you get your authorization and you log into the portal and you're able to successfully download, finding the time to really sit down and look at that information and make sense of the table and the summary, it's just difficult on the practice side to find that time to really focus on that information. There's a lot of it, and it's one of these added pieces that if you're not really familiar with the data elements, it's a lot to understand. So hopefully our discussions will make that a little bit easier for you. But that's another barrier. And I think CMS has heard that. We've definitely said that on the listening sessions, that it's great that we have this data, but it would be even better if it were analyzed in a way that made it easier for us to digest. So we're very hopeful and optimistic that the next iteration of this type of data will include some more, intuitive information that will help us understand how we can impact cost and what might be some of the key drivers. So really the barriers are accessing it and then having the time to adequately digest it. And then really the third piece is the communication back to the provider. So if you're the administrator, you've downloaded this information and you've reviewed it, then pouring it out to the physicians and making sure that you're able to explain it in a way that resonates with them, and finding the time to do that. Whenever I've presented this information to a group, we've found the best time to be really after hours. It's something that there are typically a lot of questions around, and doing it when you have 30 minutes, it's you're just scratching the surface. So really what that really means in my mind is prioritization. So if it's really important, you'll be able to carve out that time, and folks will be amenable to that. However, if you don't give it enough time and allow folks to ask questions, usually groups are not getting really all of the meaning out of it that they should. And then also, I have found this just in general with elements of the quality payment program. Sometimes you have to see this data a few times before it really starts to make sense. So if this is your first time looking at it, the next time you look at it and when you pull down September data, you might be, a lot of it might resonate with you at a deeper level. So that's another piece. It's just becoming familiar with the information is going to take us all a little bit of time.
Thank you, Doral. That's very helpful. And I did get a question in the chat from Barbara. Where do we get the insurance company's per capita cost data?
Oh, that's a great question. This is a little trickier, but a lot of them you can ask for your practice assessment report, or it might be called a quality and efficiency report. But I think that's the question we need to ask them. I've seen this from Cigna. I've seen this from United Healthcare, and I know some of the Blues provide this information as well. I think the way to do this, though, is to really get on the phone with the payer and tell them what you're interested in and see if they can provide that payer profiling data to you. But it's called different things at different payers, so you might need to further explain what it is you're looking for. And the way that I always suggest folks ask for this data is we're really looking to identify what to prioritize in terms of focus for our groups. We are all working to get better and better and better. And without information from our payer partners, we are completely handicapped. So it's kind of the old help me, help you argument. And I think if you pose it like that, it might resonate more with the payer. But a lot of them already have these reports run, and they look at them to build their networks. And we, I think now, are just starting to ask them to share that information with us which, again, is going to help us in a lot of ways. Great question. Thank you.
Great. We don't have additional questions in the chat at this time. Any other experiences, thoughts? Thank you, Doral, for sharing thus far.
No, I think I'll go ahead and step back, and we can look a little bit at the closing piece here. I believe we have a few pieces of information in terms of resources, and I'm not sure if I mentioned this before at our in-person session, but the Medicare Learning Network, there are really a series of videos, and a lot of them are super short, where you can learn about specifically alternative payment models or the Advancing Care Information category, and they're really great little resources. So we've given you the link to that. You can check that out. And of course, the Quality Payment Program, they've actually overhauled their website look and feel. So don't be alarmed when you go there. Everything's still there. It's just in a little bit of a different place, but that's a really good resource. And then we've got the Center for Medicare and Medicaid Information Center. This is good particularly if you're interested in an alternative payment model, because you can. It's pretty easy to get to that information through that website. And then lastly, I have the HCP Land as a resource as well. They are actually hosting another summit in the fall. They just pushed out those, not the invitations haven't come out yet, but I believe, I want to say it's October 30th is the date of the conference. That's free. So that's another resource. And if you're not able to attend that, there are still working sessions going on and lots of white papers coming out of that group that will help us understand what's happening from a data perspective, particularly around episodes of care, which we've just got to continue to be keeping our eye out for as those things roll out. So, the other thing I would love to hear from everyone is what would you be interested in terms of future content around cost and these types of subjects that we've talked about, both in the in-person session and today. What other questions do you have or that you would love some information around? It'd be really good for Jacqueline and I to hear what your thoughts are on that.
Everyone has been unmuted so that they can go ahead and directly ask any questions that they have.
There's a little bit of feedback occurring. So if it's from you or your note, Bob, please mute yourself again. All right. With that, I think we can conclude this webinar. But to your point, Doral, if anyone does have questions about additional knowledge or skills or information related to utilization and quality payment program questions in any way, feel free to direct them to Bhavna. She will help make sure that we incorporate them into future community learning calls or content for the curriculum. So I just want to give a sincere thank you to Doral for sharing your expertise and your experience, not only with the data, but then, of course, your experience with practices and how folks have utilized it. We'll absolutely send out the recording to everyone and the macro article, as well as the direct link to provide comment to CMS. If there's any additional needs, feel free to reach out to Bhavna directly. And thank you again, Doral. Really appreciate your time today.
Thank you. My pleasure. Have a great day, everyone.
All right. Take care. Goodbye.